Critical thinking is an essential skill for nurses to develop. In part 1 of this video, we defined critical thinking. We reviewed how it connects to the nursing process, benefits of critical thinking, and the levels of critical thinking. In part 2 of this video, the components of critical thinking are reviewed and ways to develop it will be suggested. In Potter and Perry, they go into detail about the components of critical thinking in nursing. These components are essential to inform the clinical judgments that nurses make on a daily basis. I think it just makes sense that in order to make safe client care decisions, you need a sound knowledge base specific to nursing. Nurses draw upon information and theory from many areas to think holistically about client care. That is why you're studying so much now. Nurses also learn from reflection on their experiences. The more experience you have, the more you are able to make safe adaptations to textbook approaches to care. Experience helps your critical thinking evolve beyond a basic level as you seek further evidence to inform your actions, such as best practice guidelines and interprofessional collaboration. Competencies include necessary cognitive processes for making decisions about client care. Some are quite general, and you may already be familiar with them. Others are specific to clinical situations and nursing. Recall that the nursing process incorporates critical thinking in each step and is therefore considered a critical thinking competency for nurses. For further detail about these competencies, please see Potter and Perry Chapter 11. Critical thinkers are truth-seeking, open-minded, analytical, systematic, self-confident, inquisitive, mature, disciplined individuals who admit to their own limitations. Attitudes are a very important part of being a critical thinker. How do you react when a client complains of anxiety? Are you curious, or do you pass it off as normal? To make decisions, nurses also use intellectual standards or guidelines that promote thoroughness, precision, accuracy, and consistency in all client care. Professional standards relating to ethics, evidence, informed evaluation criteria, and professional responsibility are also key for informing decision-making. As you can see, there are a lot of things that influence your critical thinking ability. As your knowledge and experience develop, so will your ability to be a critical thinker. Always strive to demonstrate the characteristics of a critical thinker. Be curious, insightful, systematic, analytical, truth-seeking, open-minded, confident, and creative. You can move beyond a basic level of critical thinking by changing your attitude and questioning what you hear and see. Be inquisitive. There are other ways to develop your critical thinking skills. Start routinely reflecting on your practice. Reflection is necessary for self-evaluation and will help you develop. Purposefully think back and analyze what happened and how you reacted. Critical thinking involves framing of one's thoughts. Use clear and precise language to reflect your thinking. Notice any intuitions. Intuition is developed from experience in nursing. It is a direct understanding without conscious deliberation. It is important to confirm intuitions with appropriate clinical observations. Concept mapping helps you identify the relationships between concepts. It is a good way to visualize what is happening with your patient. It helps to train you to organize information in a way that forms meaningful patterns among data and gain a holistic understanding of the situation. Remember, critical thinking expands with experience. Keep working to change your approach to thinking, and be sure to question what you hear and see, even if you hear it from an expert. For more information about critical thinking, explore some evidence. These references may be a good starting point. For more, you can subscribe, visit my website, and click on videos of interest on this slide. If you haven't already seen part 1 of this video yet, be sure to check it out. Thank you for watching.